it's become so political, it seems that if you side with the right, you don't wear the mask. If you side with the left, you do wear the mask. And there are actually people that are making fun of people that are wearing the mask.
Oh.
Yeah.
No.
So, anyway, Dr. Kevin Kavanagh, good morning, sir.
Oh, good morning, sir.
Well, you were a retired eyes, ears, nose, throat, and wallet man. So tell us, are there people that would have some problem with wearing the mask?
Well, there are some, and I do believe the governor exempted wearing masks for medical reasons. For example, if you're on oxygen, if you have decreased capacity to breathe, that would interfere with wearing a mask, and probably you need to be exempted from that.
Also, if you're like eating all the time, that would be one thing too.
Well, if you're eating all the time, you probably should wear a mask. I know there's a lot of things that you've learned about COVID-19. The other thing I've learned, if you just leave your clothes in the closet for a long time, they tend to shrink.
They do. No kidding. I found that out the hard way too. Okay, so our question of the day, as you heard, is should we have an order to wear the mask rather than just being a suggestion? And where do you come down on this issue?
Well, I'm going to kind of punt on this. There's really, Jack, two issues. One is a public health issue, and the other is a political, legal, constitutional issue. And as far as I'm concerned, you've got to look at the public health issue and wear the mask. If you don't like the legal issue, we'll fight that in courts. But while you're fighting it in court, wear the mask. And if by chance you win afterwards, wear the mask. Because research, and just do it for what you feel is right. But still, on the public health side, 90% of the spread of an asymptomatic carrier can be stopped by wearing a mask, especially if you're coughing or sneezing. And that's what masks are for, if you're an asymptomatic carrier trying to stop that spread. And it's going to be key to getting control of the epidemic. The other thing I would like to add is that when you talk about constitutional issues, I believe they're referring to public places. If it is a store, that store owner has the right to protect both himself, his employees, and other customers by requiring people to wear masks in his store. I mean, that's his store, and I do believe that firmly. And I even heard that on Fox News. I think the commentators on Fox News believes that. So when you're in a store setting and the store requires you to wear masks, please do that, because if you don't, it will discourage other customers from going into that store, which will have a very negative financial impact on the store owner. And he also needs to protect his employees. So my message is, please wear the mask. And this isn't really a political issue. If you look at Massachusetts, where Charlie Baker's the governor, he requires people to wear masks. Governor Baker is a Republican. This is a public health issue. It is not a political one. And if we politicize it and we divide ourselves, the virus is going to end up winning.
All right, let's go back to last Friday, and we were talking about this at the end of your broadcast on Friday. And that's food handling, with restaurants, many of them beginning to open with, 33% capacity. Talk about food handling.
Yeah, food handling, I think, is very important. I think all food handlers, people in restaurants, whether they're employees or patrons, need to be wearing masks. That is absolutely key. When you're inside a dining area and you're going to have in-person dining, that is a very difficult area to keep people safe. Even in Sweden, where they say, well, we've opened up the restaurants, they do social distancing where tables are 6 feet apart. At least that's what the news media is reporting. And even at that table density, I think restaurants are going to have a very difficult time opening up. And that in itself may not be safe because, as you know, you can't wear a mask while you eat. And that's going to be tough. There's new studies out that shows that if you're talking loudly, which sometimes happens in restaurants, or you're sneezing or coughing, you can get viral aerosolization and spread. And some of the studies show that it can be greater than 6 feet. So I think in restaurant dining is a problem that I'm not sure right now you can be absolutely safe. You'll have to kind of weigh risk versus benefits, whether you're in an area that has a high number of COVID-19 patients, and judge that and make your decision yourself. But I should add that it's not just a problem of the big cities. We have a hot spot in Warren County and some of the counties which are out in the western part of the state. So rural counties can be affected by this too.
Ollie?
Dr. Kavanaugh, I saw over the weekend a friend of mine posted on Facebook, if you don't like wearing a mask, you're going to hate wearing a ventilator. And I thought it was funny and I got the point, but I thought about it later and I thought, that's not really accurate. What's more accurate is if you think you don't like wearing a mask, you're going to hate watching your parent, grandparent, child, neighbor, whomever wearing a ventilator, because that's really why we're wearing the masks, right? It's to protect people from us.
Yes, that's correct. If you're an asymptomatic carrier. And there's some concerns that, maybe the virus will reactivate. That sometimes viruses do that, such as cold sore viruses. So that is absolutely correct. And as we've seen by a case in Kentucky I think he was a virologist that flew on an airplane, was wearing a mask, and said he came down with the virus, thought it might have got in through his eyes. And we've talked about this again and again, that don't think that mask is going to protect you, because if somebody's got COVID-19, you're close next to them and they sneeze on you, you're going to get covered with virus particles head to toe, and then what do you do? So that is, the masks are primarily to protect the spread from you to other people, and there are some studies which have shown that up to 90% of the viral droplets can be screened out by a simple do-it-yourself mask. So that is very good news, and that's very recent studies, and that's a way we can put a handle on this epidemic and be able to open up safely so we don't see that spike or that continued uptick of patients which people are predicting. Right now, the good news is cases are going down, and let's hope with the warm weather, proper social distancing, people wearing masks, that this will continue. Because remember, this virus doesn't care about any of this grandstanding, any of the politics, any of the narratives or the rhetoric. It's out there to win. And that's what our adversary is, and we got to defeat it. I kind of view this kind of like in World War II, when bombers were flying over, being required to shut off your lights at night. Because if you turned your lights on, the bombs would fall. Well, people would be, I guess, going out now protesting, it's my constitutional right to have my lights on, turn them on if you're on this political persuasion. It's crazy. We need to look at the public health issue. You want to fight it out in court, do that, but still wear the mask.
Yeah, and I always knew you were a smart guy, but now there's no question about this. Dr. Kavanagh just about always follows up with an email after he's on with me. And on Friday, he said in his follow-up, my wife said I talked too long, so sorry, she's always right.
Well, that's the advice I gave my sons when they got married. It's just, your wife is always right. It'll just make life a lot easier. If you tend to buck that, they'll break you, and you'll wind up in that situation, in philosophy anyways. So just adopt it sooner. Life will be better.
Dr. Kavanagh, thank you very much. We'll talk to you on Wednesday, okay?
Thank you, sir.
Isn't that great?